right, just a little bit of music to get you excited about talking about pain. Finishing up with post-op, we just have a couple more slides to get through, and I'll try to be brief. With pain and discomfort, the biggest thing is pain is your fifth vital, so you do want to take your vital signs and also add in the idea behind pain. When you are considering pain, you need to remember your PQRST or the Colder assessment, but you need to consider the type, extent, what is the length of surgery. We need to administer medication, and then once you've administered medication, you need to follow up and ensure that that intervention helped relieve the pain. So also take a peek at your patient's physical and emotional signs of pain. So is there any facial grimacing, frowning, guarding, anything like that? Physical and emotional signs of acute pain. Besides what you can look at when you see your patient, watch your blood pressure, pulse. We know that pain increases our sympathetic nervous system, the fight or flight. So we have an increase of epinephrine, norepinephrine that will increase pulse, blood pressure, respiratory rate. You might notice that your patient is sweating or diaphoretic. Watch for restlessness, wincing, moaning, and crying. So for medications that we need to consider, first we need to consider how we're going to administer them. And in the immediate post-op period, we'll be giving medications IV. So, and typically it's going to be fentanyl is that you're going to be seeing used in PACU, because fentanyl has a very quick onset, short half-life, short duration. You may see morphine being used as well. So IV push for a PCA, you may see Demerol or morphine. They have had recent studies shown that they tend to, I think they're looking toward taking Demerol off the market because of its extent of toxicity, especially in the elderly. And then we want to move from the PCA to oral pain medications. So we want to make sure that as our patients heal, then we consider decreasing. We might be starting with IV push, we might give them a PCA, and then after a day or two we need to switch them over to oral pain medications. So your oral might be Lortab or Vicodin. You might see Tramadol, several different things, and those might be choices to consider. Complementary and alternative therapies, what can you do to help alleviate some pain? Changing their position, maybe massaging an area or giving a back rub. Some relaxation techniques or diversion so that they're not just sitting there laying in that bed thinking about how much they hurt. Also, we do have to remember complementary drug therapy, so the Zofran for nausea and vomiting, and then Meclizine helps with whirling, vertigo, or dizziness, kind of like car sickness. So those might be some things. Scopolamine patches is another medication that oftentimes they will use if people have severe reactions. Community-based home care, we need to remember upon discharge of our patients that we do have them set up with home care management, and we need to teach for home management. So what is a teaching plan? We're going to devise some in the classroom, and then we also need to think of the resources that these patients might need to utilize once they are discharged. So your iClicker questions again are always as follows, and so remember to take a look at those, come up with an answer, and we will discuss these when we meet in class. And I thank you very much for your time and attentiveness to postoperative nursing care. And we will finish with pain, the fifth vital sign, and discuss that on the next few slides.